Hello viewers, welcome to Vlog32. You are watching Pathology Discussion Forum, and in this vlog today I'll talk about the basic structure of a platelet and its functions like adhesion, aggregation and secretion or release reaction. So this is the basic structure of a platelet. Platelet is a blood cellular component. Rather, it is a part of a cell that is punched off from the megakaryocyte, and it is a 2 to 3 micrometer diameter component. So this is a platelet, and it has somehow a round structure with some projections in the boundary. Regarding the structure of platelet, there are presence of two zones in the platelet, and this is devoid of any nucleus. So the peripheral zone of this platelet, this is known as hyalomere, and this is relatively less dense area, and the central portion that is comprised of various granules and various cellular organelles in the central portion of platelet. This area is known as granulomere. So it is the basic division of the platelet cytoplasm. Now coming to the various receptors on the surface of platelet. First, coming to this receptor, this is known as Gp1b. There is presence of another receptor that is known as Gp1a. I'll be talking about the functions of these types of receptor in the later part of this video. And here is another receptor that is known as Gp2b 3a. So the first one, that is Gp1b, the second one, that is Gp1a, and third one, that is Gp2b3a. So these are the surface receptors on the surface of a platelet, and these receptors play vital roles in various functions. Now coming to the central part, there is presence of various granules, and among them these dark green colored granules are dense granules. They mainly secrete ADP, and this ADP is utilized in the process of adhesion and aggregation. Now coming to the light green colored granules, these are the alpha granules, and these types of granules, they secrete platelet factor 4, which will antagonize the effect of heparin, and there is also secretion of the platelet derived growth factor, and it will be helpful in the process of vasculogenesis along with stimulation of the fibroblast generation. Now coming to the process of adhesion. Adhesion means attachment of platelet to the soft tissue or the vascular wall. If there is any kind of tissue injury, so there is injury to the endothelial layer of the blood vessels, and these are the endothelial cells. So there is a breach in the continuity of endothelial lining. So there is exposure of the subendothelial collagen, and these are the molecules which will help in the process of adhesions. That means attachment of platelet to the vascular wall. In this process of adhesion, the most important molecule is Gp1b, and it will attach with the subendothelial collagen with these yellow colored molecules, and these are known as von Willebrand factors. So for the process of adhesion, the most important surface molecule, that is Gp1b, and the most important bridging protein, that is von Willebrand factor. So these two factors needs to be present during the process of adhesion. If there is any deficiency or defective formation of the Gp1b receptor, then there is a syndrome called Bernard-Sollier syndrome. It will lead to some bleeding manifestations, and Similarly, if there is deficiency of this von Willebrand factor, then the process of adhesion will not take place, and this will also result in some bleeding disorder that is known as von Willebrand disease. Now, what is the role of this Gp1a receptor? This Gp1a receptor, it also helps in adhesion, but it does not require any von Willebrand factor for adhesion. In case of Gp1b, there is requirement of the von Willebrand factor for the adhesion, but in case of Gp1a, there is no need for any von Willebrand factor. Now coming to the next receptor, that is Gp2b3a. This receptor is important for the process of aggregation. That means there is attachment of one platelet with another, and this process, this attachment process, is vital for the formation of platelet plugs. So first there is adhesion of the platelet with the subendothelial collagen, and this process will lead to activation of platelets. Activation of platelets means there is structural change of the platelets. The structure of the platelet, it will become from round to a structure with projections or pseudopods, and after this activation there is the process of aggregation. Aggregation means there is attachment of one platelet with another with the help of this Gp2b3a receptor, and here this process of aggregation, for this process there is requirement of one molecule, that is fibrinogen. So for the process of adhesion there is requirement of von Willebrand factor, and for the process of aggregation there is requirement of fibrinogen. So in a simpler way, for the process of hemostasis, first there has to be adhesion. That means the platelet has to attach itself with the subendothelial collagen. After that there is activation of the platelet, and there is various structural changes along with release of factors like ADP, platelet factor 4, platelet derived growth factor, and also there is production of thromboxane A2, and this thromboxane A2 that actually generates from the wall of this platelet. From the wall of the platelets, with the help of one enzyme phospholipase, the arachidonic acid like compounds are generated, and from that compound, with the help of the enzyme thromboxane synthetase, the molecule thromboxane A2 is generated, and this thromboxane A2, this molecule will help in the release reaction or secretion of platelets. So this is the process of adhesion, as well as there is activation of the platelet, there is aggregation leading to formation of platelet plug. Now the normal count of platelet in peripheral blood is around 1.5 to 4.5 lakh per cubic millimeter, and the average amount of stay in the peripheral blood for a platelet is on an average it is 10 days. So this is the basic structure of platelet, and this is the process of adhesion along with aggregation and platelet activation. Okay, that's it for now. If you are new to this channel, then don't forget to subscribe, and also follow our Facebook page to get our recent updates quickly. And if you have any query, then post your question in the comment section below. Thank you.